So now current levels of social distancing are inadequate at this stage of the coronavirus pandemic. A slight increase of 2% will see the number of cases reduced by 18%, while a 2% decrease will see a 23% increase. This is according to a mathematical model developed by researchers at the University of Johannesburg. The research also found that there is a need for more aggressive multi-control approaches. For more on this, I'm joined by Professor Farai Nyabadza. Professor, thank you so much for joining us this morning. I read your article and so many numbers and permutations and so forth. So let's try to keep this as layman, to speak to me as a layman, which of course I am. Okay, where do we stand at the present moment when we look at our social distancing regulations?
We are pretty, it's hard to say, but at the same time, there is sometimes nothing you can do when you have to do a balancing act between surviving and at the same time fighting the epidemic. From the information that we got from some Google mobility data, we were actually roughly standing at around 55% people staying at home, and of course the rest 45% going out there.
So now we have this scenario. We have to open up slowly, which is happening from level 5 to level 4 because we have to resume economic activity. And you're saying relaxing social distancing by just 2% can result in a 23% number of cumulative cases. But there's almost nothing we can do about that. Just quantify your data for us, please.
Indeed, there is actually nothing that we can actually do about that because people have got to eat and people have got to survive. But when we look at the epidemic itself, it has actually been growing exponentially. And the rate of increase, apparently, it has been alarming, as we have seen in a number of countries, in China, in Italy, and even in the US. And the 23%, for your information, within the South African context, would have been 23% of maybe a number like 1,200, which would probably be in the region of 200 to about 300 cases a day, which is exactly basically what we are observing at the current levels of increase in terms of this particular epidemic.
You're also advocating for maybe the increasing the levels of social distancing. If we just do that by 2%, reduce the numbers by at least 18%. But also you're talking about more aggressive multi-control approaches. Talk to us a bit about some of those approaches.
I'm so glad that there are now regulations that actually require that we actually wear masks in public. And there's also been an aggressive campaigns through the media for us to actually get to grips with this particular epidemic and actually how to avoid it, including aspects of hygiene and, sanitization, and even within our taxis, reduction in the number of people, especially with the crowding effect. Especially when we move to stage 4, we are going to see again an increase in the number of people crowding in certain places, and that crowding itself has got a propensity to actually increase the epidemic or increase our contacts or the number of people that we contact each and every day. And that increase actually has got the propensity to sort of like increase the numbers. But look here, with respect to this particular epidemic, even though we might try to actually reduce these particular, we may try to reduce the numbers, in my own view, there's actually nothing that we can actually do. The only thing that we can do is to just manage the epidemic as it comes, because certainly the numbers will rise, and we just need to make sure that the numbers don't rise beyond our capability or our capacity to handle the increase in the numbers.
When we talk about the fact that we almost have no choice, you've got countries like Sweden who relying on what they're terming the herd approach mentality. I'm just forgetting the correct phrase. But talk to us about that.
Immunity.
Yeah, herd immunity. But talk to us about that. Is that something that maybe we should be looking at?
it's for some reason we can actually also look at that. We need a bigger number of people actually taking quite a lot of precautions, or maybe some of the industries where there is quite a lot of crowding. If there could be some kind of a cautious approach, this could actually be protective to the greater population.
And just lastly, sir, this is going to be with us for a long time to come, isn't it?
Very much so. We the models that we have actually been looking at the current levels. If we had continued with the current level of lockdown, the model actually showed us that we will actually have gotten to maybe a peak within around August, somewhere there in September, and any other intervention that we are going to institute will certainly sort of like flatten the curve, and in flattening the curve, we are sort of like lengthening the period that we will have this epidemic with us.
Okay. It's interesting stuff, crunching all the numbers there for us. That is Professor Farai Nyabadza from the University of Johannesburg.